Welcome back to this episode of Babbling Beauty. It's been a minute, and we're expanding faster than ever. We're bringing functional medicine to Misha Wellness right in Center Valley. Join us today with Michelle Balbi, business owner of Misha Aesthetics, and her newest hire, Jamie, who will introduce herself and everything she does. Michelle's going to play the role of a brand new client who knows absolutely nothing about functional medicine and what she can do. She's going to go over her own symptoms, what she's looking for, and you're going to follow Michelle on her journey as she learns about these services and then goes through testing as well.
Okay, we're super excited to be here today. Again, I'm Michelle Balbi. I'm also a nurse practitioner, and Jamie is as well a nurse practitioner. But I have a lot of questions about my own well-being, and I wanted to work with Jamie to kind of break things down and look at my body functional medicine-wise to see why I feel the way I do. So to give you a little bit of background, I am 57 years old and very interested and started on hormones. So we're going to start talking a little bit about hormones, and then we're going to transition into probably a little bit about gut health. The other things that we will talk about in the future, just to give you a timeline, is we'll come back and we'll talk about different IVs and injectables that can go hand in hand with both of these topics. But let's get started with hormones first. So Jamie, I'm coming in with issues that I would say some post-menopause at 57, still dealing with some hot flashes, tired, and for me, let's say lack of libido. What would be some possible testing that you would want to do for me to see where I'm at in my journey, and then what suggestions maybe we could do for my hormones?
That's a great question, Michelle. So initially, I would want to look at your whole being. So I would want to do pretty good blood work. I would want to check everything, all the things that we should check every year to keep you nice and healthy. That would include a good thyroid panel, all of your hormones. I would also really be interested in testing your vitamins, your minerals, your heavy metals, your amino acids, just to make sure that you weren't deficient in anything.
And would all those things be tested with blood work?
Yes, that's all blood work. Just to make sure that you're not deficient in anything or have anything off kilter, because when that happens, that can cause fatigue and brain fog and all the symptoms that come with menopause. But I would just want to make sure that everything else was okay first. Then, we could look into your gut health. We can make sure that everything is well with your gut, because as we all know, that everything is related to gut health. So, whether somebody has rashes or headaches or joint pain or, whatever it may be, it's usually something that's off kilter in our gut. So there's lots of testing that I would want to do just to make sure that everything was okay.
So in general, is the test typically covered under people's insurance?
So that blood test is usually covered under people's insurance. They would still have to pay, their co-insurance or their deductible, but I code it very well, so it's usually covered under your insurance.
Okay, that sounds actually awesome. And is the gut health also something that is blood work, or is it something else?
So that would be a stool test. I would send you home a stool kit where you would, collect the sample and send it in the mail.
Okay, very interesting. So once you got my blood work back and we look at everything, let's talk about the hormones first. If my hormones are off, what are some options at the Wellness Center for me to help increase either my estrogen, progesterone, testosterone? What could we do?
So there's a few options we could do. We could do an estradiol patch. We could do some testosterone cream. And we could do some oral progesterone. And we could also do pellets. So all different options. If it, for men, we could do an injection of testosterone. So there's a lot of different options.
Okay. So the good news about that is it depends what works with your lifestyle. And if you're somebody who's really good with taking medications and applying topicals, that might be a good option for you. But if you have a busy lifestyle, and you might find that the pellet could be a better option for you. And one of the things that I've learned about the hormones is they're bioidentical. So the cool thing about that is they match your receptor sites, so they're catered for you. Am I correct on that?
Yes, absolutely.
Okay, terrific. So if I opted to do something like the pellets, I know for women they're replaced every 3 to 4 months, and for a man every 5 to 6 months. And how often would I need to get my blood work done typically?
For the pellets, I would say initially maybe the first 3 months, and then after that every 6 months or so.
That's terrific, because we really do look at the symptoms that go along with it. So once that gets all regulated and we're feeling pretty good, you also mentioned checking the gut health. So when you get that test back, what are some of the things that you get on that test that could help me with the belly issues that I sometimes feel like I have?
So that test is so very cool. I mean, it's going to check everything. It checks our good bacteria and what we're lacking. So not one probiotic is good for all. It will check our bad bacteria, exactly what bad guys we have and how do we get rid of them. And usually we can kill them off with herbs. It'll check parasites, worms, inflammation, your digestive enzymes, yeast, candida. It really gives me it gives me a really good picture.
And how often do you do something like that?
So normally when somebody has symptoms and then we'll treat it, it's usually a quick, easy fix. And then not really necessary to treat again unless you become symptomatic in the future.
Okay, that's actually very fascinating. Another piece you had brought up was testing minerals and other things along that line. What does that actually tell you?
So that's a great question too. That will tell me, so we can do a really cool blood test where we check your vitamins, your minerals, your heavy metals, and your amino acids. So it really tells me what you're deficient in. So even somebody that eats a very healthy diet, I find those people are very deficient in things. It's, our food today and our diets, and it can cause such a ruckus when things aren't right and they're not balanced.
So a lot of the symptoms that you're saying that people are getting could possibly be corrected with certain over-the-counter vitamins and more homeopathic things. Is that correct if I'm understanding you?
Yes, absolutely.
Okay. And I'm assuming all vitamins are not the same. Is that correct?
Yes, that's correct. There's certain vitamins that, are more brand specific that I would, rather have somebody use than an over-counter, say, Centrum Silver.
And I guess it's tough because Amazon's the way of our present day or the future, and people do order a lot of times on Amazon. But something to keep in mind is we're not exactly sure always where the vitamins or medication is coming from. So we do tend to steer our clients into making sure that they're getting their supplements with a reputable company. One of the things at our company that I do like, especially dealing with pellets, is we work with a company called BioT, and they do have a whole line of nutraceuticals. Are you able to cater to each individual person, what they need, or is it cookie cutter and everybody's getting the same thing?
No, everyone would not be getting the same thing. It's your personalized, vitamin formula. So whatever you're deficient in, it would be, it's different for everyone.
Okay, that's fascinating. And then as a final piece to this today, because we've talked a little bit about the hormones, coming in for a consult, getting blood work done, and then deciding what's best for you if you want to do something topical, oral, injections, or pellets. We moved on to recap and talked a little bit about gut health and discussing, what's going on inside that's maybe throwing us off a little bit. And for some people, that could even be constipation, diarrhea, or just general fatigue, headaches, all kinds of different symptoms. We talked a little bit about minerals and taking different nutraceuticals to help out with that. I think as a final piece that kind of will wrap all this up for us is, how about weight loss? A lot of people are into weight loss now, and one of the big topics is what they call the skinny shot, otherwise known as semaglutide. if people are dealing with hormone issues or gut health issues, is it still safe to also cross into a journey of weight loss at the same time as you're doing hormones?
Yes, absolutely. I believe that the two go they go hand in hand together. So when we go through menopause, we're finding that the GLP-1 hormone gets broken. So oftentimes people will come in and we'll put them on hormone replacement therapy, bioidentical hormones. And the one thing that just never seems to get better is weight loss. It's the struggle. So I find that adding in a GLP-1 hormone really, really helps in combination with hormones.
Okay, so that's fascinating. So originally when we had brought on bringing the weight loss medication in, we really focused on people with a BMI above 25, but we realized over time that it's not just specific for people who are deemed obese. It really is for people who may be struggling because of possibly polycystic ovary syndrome. It could be menopause. So there is a little bit more of a leeway in who we prescribe this medication to, correct?
Correct, yes. We're using them for, MS and addiction and polycystic ovaries, inflammation, heart disease. The list goes on and on. They're fascinating.
So basically what we're offering at our wellness center is what we're going to call the Fountain of Youth. We're going to give all our patients an opportunity to see what's going on beneath the hood. Very much like the maintenance we do for our car for oil and putting gasoline in. We as human beings need to continue to function to the best of our ability. And in order to do that, testing does need to be done. And we have a way for you to kind of see the whole picture. If you're interested in coming in and talking about any of these topics today, Jamie is available and she would love to see you. And if you have any questions or just want to come in for a consultation, please reach out to our office at Misha Aesthetics and we can set that up for you as well. Do you have any closing remarks, Jamie?
I am very excited and I hope to see you all at the Wellness Center.
I hope everybody has the most wonderful day and we look forward to working with you on your journey.